You want to make sure, is this a life event? Is this something I could call First Stop Health for? You know, that would be a way to cover it if you stayed on the EPO plan outside of this area. But to answer your question, I think there'd be parameter. I'm not going to be able to say cut and dry, but if it were life-threatening, then it's a true emergency. Yes?
Oh, I just had a question because at the bottom it said, I'm sorry, urgent care just goes across $20 copay. There's no in-network, out-network. So if you went to an urgent care in another state, is that then covered?
So,
for that type of situation?
So this EPO plan, there is no out-of-network coverage. There never has been. It has always just been an in-network benefit.
That's a trick.
Yeah, it has always been an in-network benefit. So if you're out of state, we're working on making sure that there can be some type of urgent care, but right now, if you were to go an urgent care out of the state, if they're not in the Medflex network, it's not covered.
And that's just now, because I know a couple of years ago it was, because we went out of state and my grandson had to go and everything was covered. And I even called just to verify afterwards, you know, hey, do we have to notify you? And she said, no, it's no big deal. It's all covered, no worries.
So if it, and I don't know.
I mean, we didn't check to see if it's in network. I mean, you just went because the child was sick and had fever, but.
Because you were on the SuperMed network, so a different network. A different network would have made that difference from a few years ago. Also, it would have made a difference if it was considered an emergency or not.
How they coded it.
How they code it.
That's all it boils down to.
I know. Makes it fun.
You almost have to fight with them in the emergency room to code it a certain way.
Well, I guess I look at it, because, I mean, I had someone bring me a $22,000 claim. She was on the EPO plan. She goes, my child went to the ER. She even said, you can use me as an example. She said, your child went to the ER, was bitten by a dog. And she went and she ended up with this $22,000. That's her patient, you know, that's her responsibility. She said, is this right? She calmly just kind of slipped it, hey, I've got something to show you. I was like, oh, most people would be like freaking out about this. She was very calm. She said, I think they coded it incorrectly. Sure enough, we went and looked, yeah, they coded it incorrectly. So I think when you get any type of provider bill or statement, it's one you really want to just say, hey, why did I go? How was this coded? We all, I mean, as you know, you work in the health district. We have to be informed consumers of our health care and where we go and why we're going and what resources we have. And I think that's why continually Lake County is trying to make sure you have other resources and looking at how do we keep that health down so it's still a very rich benefit for you. So, you know, thank you for asking these questions because I think it helps everyone's understanding. One of the things we sent out earlier today was a recording from Medical Mutual about the Medflex network. So that will be shared with you all. The other thing is I'm going to be diving into the Lake Blue network. And there is a provider panel of the Tier 1 Lake Blue provider panel. And so if you have a question, is my doctor considered Tier 1, Tier 2? You can look up on that provider panel. Right? I'm going to talk about Lake Blue a little bit. So this is on page 10. This is how I wrap my head around the Lake Blue plan. This is kind of, if you were to put your hand over the Tier 1 column and just look at Tier 2, Tier 3, you've got a plan with an in-network benefit, Tier 2, and an out-of-network benefit, Tier 3. That's just, and it's the SuperMed network. Nothing is changing on this plan. All we're doing this year is I want to make sure you understand this plan, okay? So the added benefit you get with the Lake Blue plan is that if you use a provider that is on the Lake Blue panel of providers, so basically Lake Health or University Hospital providers in Lake County, you would be charged a Tier 2 benefit. Okay, you would have the deductible, which is 0, or the Tier 1 copay. So basically, look at, okay, I've got this plan, it's $1,000 deductible, Tier 2. If I go in network and you look at what are the, out-of-pocket maximums, However, if I use a provider that's in Lake County and on that Lake Blue panel, then I get the added bonus of I pay less of a copay or I don't have a deductible. The reason I say that is with the sale of Lake Health to university hospitals, one of the things that we've been working on, and I realize is we have tried to encapsulate those providers knowing that they are moving over to university hospitals. And so we have made sure that we've got a panel, and it is a lengthy list. So we shared that as well through a link of here's this panel of providers. We're calling it the panel of providers effective 12/1 that's been put together for this special panel where you would get an extra discount, or you would get the discount or a different rate for using the plan. Such as, let me use an example. Tier 1, let's say you went to a primary care visit, or Tier 2, you'd have a $35 copay when you go to the doctor for a sinus infection. If by chance they were on that Lake Blue panel of providers, you'd have a $10 copay. Okay, that's the difference. If it's a Tier 1 provider, there is no deductible with it. There is a $1,000 deductible, single deductible, $2,000 family deductible for Tier 2. It's the same network you have right now. It's the SuperMed. Preventive is covered the same way. Emergency covered the same way. You just have in-network benefits, out-of-network benefits, and one of the broadest medical mutual networks, the
So you
SuperMed.
almost have to know when you go to the doctor's office which tier they actually fall under to pay that copay, because the girl at the front desk is going to say, I don't know what tier.
And they may not. You know what? They may not. And if they don't adjudicate it correctly, please bring it in and let Adam know so that we can go back and research and say this should have been processed differently. We can go to Medical Mutual and they can code it differently. So it should say your benefits should be listed of what tier you are on. And you can say, hey, you are a Tier 1 provider, this is what you should be charging me. And I mean, they've got to code it that way and process it in their system as well. Either plan, as we all know, healthcare takes the investment of knowing our plans, and it's, I think, really the big one. You know, you've got broader coverage or broader network of coverage with the Lake Blue plan and the ability for a little bit more discounted copays and deductible if you use one of those providers from that panel. And I realize that's a change. I realize that is a change for a lot of people, but take a look at that. I think you'll also find that that's a lower price plan. I always say do a cost-benefit analysis. Think about how you use your healthcare. Think about how you use your healthcare. Do you have a deductible? Do you have medications? How many times do you go to a specialist or a provider? How many times are you paying copays? And you can check that out. You should be able to see that on your explanation of benefit and get an idea. Also, you want to take a look at what is the premium you would be paying. What is out of your paycheck? A lot of times we have premium that comes out of our paycheck and maybe we pay attention that first time it comes out for the new year, and that's it. But think about it annually. So if you were to think about, hey, if I had a catastrophic, if I were to have an event where I had to be in the hospital, how would I use my benefit and what would my total out-of-pocket cost be and my annual cost be? Who are my providers? Think about that. And I think if anything, this is that moment that you pause and you think about, how am I using my healthcare?
So again, when you said a Lake Hospital doctor, they have to be in Lake County, correct? So if it was a doctor like that is registered as a UH doctor in Beechwood, that would fall under Tier 2, correct? Because they have to be Lake County.
It needs to be a Lake Health provider, not so much where they're, I'm going to just phrase it this way, because we tried to capture, and we have been pushing on this, to capture, knowing that some Lake Health providers, they are going to be, maybe they've got an address like in Beechwood. But we tried to capture those providers, if they're a Lake Health